Prevalence of drug-resistant tuberculosis among children in China from 2000 to 2010 by Lisa Romano, Con Doon, Arlene Aguilar, Mei Yang, Suzette Aranda, and Jessica Carbone, California State University, Long Beach. Before we further discuss this topic, let's go over some important concepts. Drug-resistant tuberculosis, or DRTB, is a type of tuberculosis that has been found to be resistant to at least one type of treatment. Rifampicin-resistant tuberculosis, or RR, is a type of tuberculosis that is resistant to this particular medication. Multi-drug-resistant tuberculosis, on the other hand, is a type of tuberculosis that is resistant to at least two of the most common treatments. Also, extensively drug-resistant tuberculosis, or XDR, is the one that is found to be resistant to at least four of the core treatments. Incidence. Cases of drug-resistant tuberculosis have been reported all over the world. However, certain countries such as China are particularly more affected by this type of tuberculosis. As shown in this map by the World Health Organization, China is responsible for 12 to 17% of all new cases of drug-resistant tuberculosis in the world. Morbidity. A study in 2001 showed that China has carried out surveys of anti-tuberculosis drug resistance in 10 of its 31 provinces. However, the World Health Organization reported that all provinces in China had levels of multi-drug resistant tuberculosis above the global median, and some had been classified as global hotspots of multi-drug resistant tuberculosis. Furthermore, another study showed that almost 25% of the tuberculosis cases in China were children, and almost 25% of such cases were drug-resistant tuberculosis. Mortality. Unfortunately, very few studies have reported on the outcomes of drug-resistant tuberculosis among children in China. One of such studies showed a mortality rate of about 10% in children with multi-drug resistant cases. It also concluded no confirmed deaths of children due to extensively drug-resistant tuberculosis. Economic impact. Reported attempts by the Chinese government to treat its affected population included making fees for treatment more affordable, as well as providing free tuberculosis drugs and x-rays for new patients. Unfortunately, this led to a multi-million-dollar debt in loans and subsidies. A study showed that low-income patients in China pay a total of $149 to $724 for medical costs and treatment for drug-resistant tuberculosis.